and welcome to Bloomberg Nursing's feature event celebrating National Nursing Week 2021. Before we begin, I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. As a non-Canadian, I am thankful as a result of the grace and generosity of the true owners of this land to have the opportunity to live and work here. It's wonderful to see so many of you have taken the time to be with us virtually. And though many of us may not feel exactly celebratory, and with good reason, we're grateful for an opportunity to recognise our nursing colleagues and those who are working to support families, patients, clients, and our communities during the pandemic. But before I begin, a few housekeeping notes. This event is being recorded and will be made available on our YouTube channel following. We will send you an email after the event, which will include the link to the recording, as well as a survey opportunity for you to provide us with feedback on today's event. Your cameras have been turned off and microphones have been muted, but will be made accessible to you again following the panel so that you can participate in our Q&A. This year's theme for Nursing Week, A Voice to Lead, A Vision for Future Healthcare, was developed by the International Council of Nurses, representing more than 27 million nurses worldwide. This theme recognises the important work nurses are undertaking as leaders in the communities they serve and around the globe, whether in the ICU or in the classroom, supporting vulnerable populations in the community, or by producing innovative research to transform the healthcare system. Our focus for this year's Nursing Week panel is centred on the role of nurses in the community, and as you can see from the title, how their primary care work intersects with public and community health. Throughout the pandemic, it has been nurses who are providing the majority of support and leadership in these community settings, whether at testing and assessment centres, vaccination clinics, or on the ground building a relationship with those who do not have access to care. They are doing a tireless and often seemingly unrecognised or unacknowledged job, aiming to prevent outbreaks and manage COVID-19 disease occurrence before a patient requires hospital care. Our three panellists, Joanne Louis, Jean Wilson, and Vanessa Wright, are nurse practitioners and faculty members at Bloomberg Nursing, and are exemplars in their field of expertise. However, much of what they do goes unnoticed by many in healthcare, by the public, and by the government. We've invited them here today to share not only their experiences, but to help provide a greater understanding and awareness of what community health nursing looks like, how it has evolved over the course of this pandemic, and how collaboration with primary and acute care can impact the health of our communities for the better. I will now turn it over to our moderator, Kelly Metcalf, Professor and Associate Dean of Research and External Relations at Bloomberg Nursing, who will introduce our panellists and set the virtual stage for our discussion this evening.
Thank you, Linda, and good evening to those of you joining us today. I am so pleased to be able to introduce you to our three panelists for our feature panel event celebrating National Nursing Week. They are, as our Dean has said, experts in their field with a vast array of experience supporting vulnerable populations through health promotion, primary care, education, and outbreak management. Public health nursing has been thrust into the spotlight due to the COVID-19 pandemic. However, the role of a nurse in the community is integral to supporting vulnerable populations in a myriad of ways. Our three panelists from the Lawrence S. Bloomberg Faculty of Nursing will share their experiences and work in the community to illustrate the ways in which nurses not only lead, but are pivotal to the field of public health and primary care. Joanne Louis is an assistant professor in our undergraduate program where she teaches primary healthcare and innovative ways to provide healthcare to marginalized populations. She strives to make the link between the clinical and academic aspects of healthcare delivery. Joanne is also a primary care nurse practitioner and has worked with populations who face barriers in accessing care, including victims of violence in Canada, Kenya, and South Africa. She is interested in advancing nurse education globally and has practiced in rural areas in Canada, Bangladesh, Dominica, Honduras, Nigeria, and Guatemala. Our next panelist is Jean Wilson, who has recently joined our faculty as an assistant professor where she teaches in the NP program. Jean graduated from the nursing program at Lakehead University and holds a Master of Health Science in Community Health and Epidemiology from U of T's Dalla Lana School of Public Health. She has also completed the Outpost Nursing program at Dalhousie University. For several years, Jean practiced as a nurse in remote fly-in Indigenous communities in Nunavut and Northern Ontario in the Sioux Lookout region. She subsequently went through the grandfathering process with the first legislated nurse practitioners in Ontario. She has also worked at the St. Michael's Hospital Tuberculosis Disease Management Program and the Public Health Agency of Canada in the Field Epidemiology Program. She specialized in outbreak and pandemic investigation and communicable disease surveillance. She has supported disease surveillance for the Canadian Armed Forces and the Public Health Agency of Canada Zoonosis Division, working with infectious diseases that transition from animals to humans, and has been deployed on several national and international outbreak investigations. In 2010, Jean returned to Toronto to practice as an NP with St. Mike's Hospital Academic Family Health Team. And our third panelist, Vanessa Wright, is an adjunct faculty member in the Faculty of Nursing at U of T and a nurse practitioner at Women's College Hospital. It's Crossroads Refugee Health Clinic. There, she and her team provide comprehensive medical services to newly arrived refugees. She has also worked in a number of community health centers in Toronto and provided primary health care and emergency nursing care in medically underserviced First Nations communities in Northern Ontario. Over the past 10 years, Vanessa has supported the Toronto Addis Ababa academic collaboration in areas of nursing education, collaboration, and advancement. Most recently, Vanessa has explored aspects of community engagement and collaborative partnerships between the healthcare sector and community organizations in COVID testing and vaccine provision in shelters and congregate settings. Her other professional experiences include working as a field nurse for Doctors Without Borders in South Sudan, Zambia, and India. Vanessa is an association member for Doctors Without Borders and a subject matter expert on the CAMH Immigrant and Refugee Mental Health Project. So this evening, we have these three very distinguished experts with us here today, and they're each going to be given 5 minutes to provide us with a discussion of their areas of expertise. And then we will have a moderated discussion with some questions. And then we'll invite you as our audience members to ask questions of these three experts that we have with us here today. So Joanne, I think we'll start with you. So welcome to Joanne, and I'll turn it over to you now, Joanne.
Thanks, Kelly. That was a great introduction. I really appreciate that. And thanks to everyone joining us tonight. So I think, one of the things that I think about when I think about primary care and how it intersects with public health has really been about giving access to care and access to populations. When I first started my nursing career, I was working mostly with homeless people who were living really rough or underhoused. And it was really fascinating to see where people lived in these parallel lives to the life that I was living. Being right next to one of the richest neighborhoods in the city, and then underneath servicing all these people who are living in the encampments. And, complex mental health issues, substance use led people to those situations sometimes, but also the structures in the society that we live in, making it more difficult for people to access care. I continued that work and fast forward a few years into when I became a nurse practitioner. And really, those themes kept emerging, mostly because I was working in community health centers, and that's where we service most of our uninsured populations in Canada. And you know, being uninsured means that you don't have insurance in any way, shape, or form to access care, but you also don't have protection. You don't have a health card, you don't have union protection, you don't have safe places to stay. And so a lot of my work has revolved around working with uninsured populations, whether it's at my regular job at Regent Park Community Health Center, but also with a number of voluntary organizations within the city and seeing what not accessing care and not having access to care looks like. And so when we think about population health, one of the populations that I work with most closely is definitely around people who are trying to access care, particularly during the pandemic. Yeah. I think you're muted, Kelly.
Of course, I would be the first one to do that. Thank you, Joanne. So thank you for providing a little bit of background on your area. Jean, would you like to introduce some of the work that you do?
Sure. So thanks, Joanne, and thank you everyone for joining us for this panel discussion. I think part of our discussion here is really around how nursing is playing such an incredible role in work that is in primary healthcare and in public health in ways that it intersects. And when I started my career, I grew up in Northern Ontario. I started my career in remote and rural communities where it was nursing that was delivering primary healthcare. They were the experts in delivering primary health care. And when I started living on reserve, and I lived there for about 6 years in total, the one thing that was always part of my experience, and unfortunately part of the experience of the communities of Indigenous people, is the extreme poverty, the overcrowding, the experiences of either insecure or poor sanitation. And that's really where, not only when I was at Dalhousie did I train to deliver primary health care, but public health was a very large part of that, delivering immunization programs and working with outbreak investigations like tuberculosis and Salmonella and Shigella outbreaks in the communities. And I think that's where I became really passionate about how nursing played a pivotal role in not only delivering the care, but working in outbreak investigation environments, which is what drove me to do the master's degree in community health and epidemiology. And when I started working with the Public Health Agency of Canada in the Canadian Field Epidemiology Program, I did work with the Canadian Forces. So part of that program is to be on call 24 hours a day, 7 days a week for 2 years, and be deployed to do outbreak investigations nationally and internationally at the drop of a hat. And I worked with other nurses. It was a multidisciplinary team, but certainly nursing played a significant role in that. And when we were deployed on outbreak investigations, it was this tremendous experience of seeing how nursing worked at the federal, the provincial, and at the public health unit that was just absolutely essential to managing any outbreak, to collecting data, case management, contact tracing. And it really consolidated to me how important nursing was in the community and how that intersected with primary health care. Even when I was deployed in the Canadian Forces, I was asked to evaluate their NATO surveillance system for bioterrorist release on troops that were deployed into Bosnia. And when we did that, again, nursing was on the ground, delivering primary health care to the Canadian Forces troops. They were the ones that were collecting the data. They were the ones that were really driving the backbone of management. And so I'm excited today to talk with you from the background, but I'm just really passionate about how primary healthcare and public health intersects in a way that as the Dean was talking about, is often hidden, and yet is literally the backbone of our healthcare system. And certainly in a pandemic, this has drawn the curtain back on that big time. So,
Great, Jean. Thank you for raising some of those issues, and we'll have an opportunity to discuss those as we move along this evening. So our third panelist, Vanessa, I'm going to turn it over to you now to share your story. You're on mute, Vanessa.
I'm off mute. Hi, everybody. Thank you, Kelly. Thank you so much, Jean and Joanne, and all the people that are here. Some faces I can see, some are black boxes, and I'm sure we can see more people later. And I look forward to the discussion that will ensue. Thanks for the introduction and sharing your thoughts, Jean and Joanne. It's always a pleasure to see you again. My name is Vanessa. I'm a nurse practitioner with the Crossroads Refugee Health Clinic. And yeah, this year is my 20-year graduation from my nursing program. And I feel very proud to say that. I think maybe 2 years ago, I would have been a little more, oh my gosh, really? But it really has. It's been 20 years, and it's been a very rich and full 20 years. And the scope has the things that I witnessed through the collaborators that I've worked with, the colleagues I've worked with, or the communities I've worked with, has been really, really inspiring. I started working in acute care. I'm driven by curiosity. I worked in pediatrics, and that took me to public health and to emergency nursing. I worked with Joanne in sexual assault nursing in the past. Again, the curiosity and angles of access to care, which I think both Jean and Joanne have talked about, have really propelled me and motivated myself through my career. I'm driven also by networking and advocacy. I've worked also in youth shelters, as well as emergency departments. And I always knew the people that I worked with, especially in acute care, I always found themes and commonalities amongst a lot of the patients that I felt I had a time to interact with. And even though I had a patient load of sometimes 6 to 7 people, and I was working in emerge, I was always drawn to having conversations with people about how they situated themselves and how they felt they were situated within their own health. And that was embellished and wrapped around with the social determinants of health, which I found I was always drawn to, and looking at people's access to care. I don't think, so some of the work that I've done in the past through working up north or working in international contexts, I don't feel that that's something that you need to actually see the diversity of healthcare within our system. I think so much of that is within our own backyard. I think global health is local health. And the pandemic particularly draws attention to that. It draws attention to so many of the inequities and disparities within our healthcare system. And I would say that, though, even before the pandemic, I would say that we have a lot of work to do here in our own backyard. So I'll leave it at that, but I would just say that I felt very privileged throughout my career to meet wonderful people, to meet wonderful patients and communities, and look at the collaboration and intersection of both community, acute, and primary care, and how the systems work within those. And it's completely engaging, and I feel really privileged to be a nurse.
Thank you, Vanessa, and thank you to our panelists. So like I mentioned earlier, we're going to start off with some common themes that we'd like to highlight, especially during Nursing Week this year. It's a very different year than we normally may be experiencing, and I think it's our opportunity to really highlight the importance of community health nursing, primary care, and how nurses are contributing to the successes that we're seeing every day. So I'm going to open this up to the panelists, and I'd like to keep it an informal discussion, hear your thoughts, and provide some insights to those of us who are not experts in this area, and there may be experts in the audience as well. So can you tell us, given our current climate and public health role in COVID-19 prevention and management, what might we expect for the future of public health nursing? And then if you could add on, just how do you think that this is going to impact the work, your work in particular, in the various community settings. So I'm going to open it up, and maybe you can talk amongst yourself and bounce some ideas off of each other. But what do you think about that?
I have some thoughts I can start with. That's okay. Yeah, I think it shows we need more. You know, we need more public health nurses. We need funding to leverage in public health. But I also think what it shows is that we need to have the leverage between public health and how do you situate that into community settings? How do you transcend the knowledge between the documents and the websites that exist that people don't necessarily access, and how do you transfer that into the community settings? I think that what this shows is that people have different channels of information and how they seek information. And I think what do these channels, where are these channels? What does the community use? I think in really using the idea of community as experts and really taking that pivotal piece of where does public health sit and how can we transfer that and refine it and tailor it.
Yeah.
Energy.
I'll add to that. Yeah, I'll add to that. I think you're right, Vanessa. I also think there's a whole room for partnership. I think we have definitely seen that there's the expert advice, there's the guidance documents, but we also recognize that there are people who the system has just left out, and and the communities that serve them have taken over and created new ways for care for them, right? When I think about all the work that's happening around the Black Physicians Associations, the Black Science Task Force, that really talks about the fact that there's distrust in the medical system amongst people and amongst populations that look like me. I also think that there's, populations that don't have a voice and that aren't able to access care. And it's the work that we are doing, the work that our advocacy agencies are doing to ensure that there's access to vaccines, access to tests for people who don't have health cards, because the system is set up so that if you don't have a health card, you can't access it. And so there's been a lot of work to talk about how do we partner with these organizations, but also how do we use these government documents and leverage them and make room for the populations who aren't getting served. Yeah.
And I'll just add to that, because I think this pandemic, as I mentioned before, has really pulled the curtain back. I mean, Vanessa was talking about 20 years, mine is 30. So, but I think what I've seen in the last 30 years in public health, we, much like Vanessa was talking about, I think resourcing and recognizing what public health does and how it intersects, and investing in that, and really making sure that, if there's nothing else that the pandemic has pulled back the curtain for the public to understand, is just how vital public health is. When things are ticking along, it's so easy to forget. And I think the only way that we can start having public health and, just the response that we need to, whether it be marginalized populations in downtown urban settings, or whether it's Indigenous populations who can have legitimate concerns around history that has to do with vaccine hesitancy and concerns about that. I think it's really important that by infusing resources into public health, that we can actually learn from a lot of the things going on in this pandemic that can actually start to support those groups in a way, and support public health in a way to reach out. Because I think now, if nothing else, the public understands a bit more what public health actually does, much more, I think, than what they paid attention to before. So.
And I agree. I think many of us are becoming very aware of what's involved in terms of public health. So what do you think some of the successes and challenges to community health nursing pre and during the pandemic? So can you think, even from the areas that you work in, what are some of the successes and challenges that you have faced as nurses within these settings? Jean, you're off
Go
mute.
ahead.
We'll start with you.
I'm unmuted, so I'll start. So I think some of the successes, I think when it comes to nursing, I think we really have, at least in my experience in my career, pushed the boundaries of scope of practice, access to advanced practice in nursing, and really taken a leadership role in providing care and care delivery in the community. I think nursing has really risen to a forefront as experts when it comes to primary healthcare and public health. And so I think that that's a success. And, even from, when I was first in school, I can really see where nursing is shining. I think one of the challenges and barriers to that, again, as I was sort of mentioning before, is that hidden piece, that the work is being done and that nursing is experts in the area, and yet in many respects it's still something that's not as acknowledged or publicized and advertised even within our public health system. Or our public health delivery system. I don't know that we're doing that good a job at shining a spotlight on nursing as being the experts in a lot of the areas that they really are. We certainly know that some of our other colleagues are experts, but I really think that has been one of the biggest barriers. And it's unfortunate to the public, I think, because they certainly rely on us heavily.
Mm-hmm.
Yeah, I would echo that. I mean, these are age-old lessons that we're employing, things that, nurses have been doing this work for decades, for centuries before COVID. And I think that we're so well situated in communities, and a lot of nurses are known and well trusted in communities that can bring the community voice forward. I think that nurses need to sit at tables where these conversations are happening. We need to have our voice heard. We need to honor and acknowledge and recognize the 360 view that we bring. And we are really weaving the fabric of the healthcare system. We are integral to the whole thing, and we are connecting in terms of acute care, community care, primary care. We are weaving this whole fabric, and I think because of that, our education allows us to look at things in a 360 view, and we're really well versed, and our diversity situates us very well to have these conversations. Unlike any other profession, I believe. So, and we need to bring our individual patient experiences forward and advocate for our patients and the things that we're witnessing.
Great points, Vanessa. Joanne, do you have anything to add?
Yes, sorry, you're on mute. I just wanted to let you know. Yeah, I think one of the things that I've taken from what's going on, aside from some real heartbreak in what's happening to our patients, to our communities, both in Canada and globally, but also to our profession, is some real creativity. I have seen some beautiful work come out of nurses. Like, I can think of the nurses that are at my clinic. They have put up YouTube videos to educate our population who don't have English as a first language. They have been running town halls. They have been the leads in vaccine clinics. They have been going and keeping our safe consumption site running so that people who are using substances have safe places to use and stay alive. I have seen some real creativity from nurses happening in really small communities, but in ways that are really impactful for those communities that we serve. So I think that is, one of the things that heartens me when I think about nursing at this time and what we're doing during this time. There's a lot of good work happening, and a lot of nurses are doing it. And I can't wait till this is all over so we can talk about it properly and celebrate them.
That's a really interesting point, Joanne. So maybe we can talk about that. How have nursing roles had to shift during this pandemic? And can you think of some stories that we could really highlight about how a nurse's role has really changed the way in which care is delivered, patients are managed? We hear a lot of stories. So can you share some of those with us?
Kelly, do you have anyone you're speaking to in
No,
particular?
you guys go ahead. I'll let you go. You're the experts here.
Yeah, the creativity is on the tip of my tongue. It's top of mind, you know, the virtual care piece. We're headed that way. It's okay. I'm accepting it, but I really don't really like it. But I think we're deciding ways that we can give virtual care. And what is this model of triage? You know, nurses triage all the time, right? And so this is this model of triage that we're doing on the phone with virtual care. We're relying on our other senses and our other skills, you know, to allow us to engage with patients and patient assessments, and also communities. And we're looking at the idea of honesty. I think the idea of working with each other and admitting that this is difficult, I think is something that's come to the forefront, and recognizing that there's a lot of depth to the conversations we can have with each other. And how do we get through this? And how do we actually figure out, how do we have conversations with our patients and with each other that are honest? And admitting that to our patients too, saying this is a difficult time. I wish I could see you, but I'm going to have to talk to you over the phone. We're going to have to talk through this.
Right.
So those are just some initial early thoughts around the curative measures and the strength, I think, that nurses do bring to this right now, and the amplification of advocacy and recognizing gaps, really recognizing gaps. And I could speak for a long time about this, but just acknowledging that there's gaps. And I think that especially what Joanne was saying about where can nurses fill that in? I think for decades, nurses have been doing this, and I think we're so good at it, recognizing the gaps and where can we fill that in and offer something that's really strong and creative. That's what I've also noticed, and it's been really admirable.
That's great. Thank you for sharing. Jean?
Yeah, I would piggyback on, you know, I completely agree with both the other speakers around creativity. I think so hard to really measure that, but the level of resilience, I see I mean, at really all levels, you know, I think of whether it's the public health agency, whether, you know, in Ontario, Public Health Ontario, the public health units, just the amount of pivoting that nursing has done in the work that they have done, and just really the resilience that they've had to show in order to, you know, pandemics and works in pandemics are the frustrating thing, I think, for everyone has been that it's new data all the time, new recommendations. It's being skilled at communicating. It's building a trust with your communities, and learning different new ways of communicating so that people are trusting vaccines or trusting the recommendations of the public health decision makers. And nursing's really been at the forefront at doing that and being creative in ways to reach the public. And whether it's on the phone as a contact tracer, reassuring someone who's either had COVID or has a family member who has COVID, to, you know, primary health care where you're reassuring people over virtual care now as opposed to in person. You know, I think if anything, this pandemic has shown the level of resilience and the level of pivoting that people can do when it's always a dynamically changing environment when you're working in an outbreak. That's just the reality of it. So big kudos, really.
And it hasn't been for a short amount of time. This really has been going on, and nurses are being asked continuously to make that pivot like you've described.
Yeah, and we're team players, you know, and I think that really comes to that. I think we're really used to working in teams, and we're used to recognizing different roles in teams and where we can push and pull, you know.
Joanne, did you want to add, or you're okay? I didn't know if you'd.
Yeah, no, I was just mulling on what everyone had talked about. And I think in addition to pivoting, in addition to shifting, I think we are ramping up. So I think there's work that has been happening with things like the Decent Work and Health Network that's run by a nurse who's really been ramping up around who is an essential worker, why are they not got sick days covered, why are the sick days that we've been given not enough to cover the essential workers? Really ramping up, recognizing that we're coming into an election, pushing forward that agenda. And so I feel like there's a lot of ramping up as well. There's ramping up from the Street Nurses Network around policing, and this government talking about, we're gonna check your ID. So I think all of that work is actually ramping up. And so it's building on the movements that are already happening and making changes that need to happen in response to the pandemic, that are about health, but also about the conditions that we live in that create or don't create health. So I think, yeah, we have totally been pivoting, but we've also been moving up and bringing up and escalating and ramping up our voices for sure.
It's a great point, Joanne. And it really makes us think, what can we do or what needs to be done to enhance the importance of public health and community nursing? And I think we've lost Jean, but hopefully she'll get back on.
Sure. Yeah. Some early thoughts are, so we recognize the great importance and value of public health, but how can we enact public health recommendations, right? How can we do that? And what principles do we really hold true to community engagement? And how can we do that within all sectors of our work? And that actually can include definitely acute care as well, acute care settings as well, in terms of reaching out to communities and creating those linkages. Just reiterating, nurses have been doing this for decades. And there's this collective that we find ourselves, right? There's community health workers. We're not alone in this, right? There's community health workers, there's community ambassadors, there's community nurses, right? So we are a piece of this. And how can we actually intersect and integrate and unify our voice in some of this work? And I think that's probably the most interesting part of this, is actually working with others in the community setting, where we're learning constantly, and from our communities, but also from other community workers who also have other equally and really amazing, engaging creative approaches to work.
Jean, welcome back. We're just talking about how we can enhance the awareness of the real importance of public health and community nursing, coming off of what's been happening with the pandemic, and sometimes there's been the spotlight on nurses and what nurses are doing. So how can we leverage that?
Yeah, I think we're in a unique situation right now in our current environment, because I think at no other time, we've had, sort of pandemics that have happened in the past, whether it be H1N1 or SARS, but it didn't impact the public the same way. And, as awful as this has been, I do think it's an opportunity for nursing to continue to leverage the knowledge now that the general public understands about public health and certainly the role that nursing is playing in it. I think when you have these discussions with the public now, they understand more than ever before. And I think we need to capitalize on that to shine a light on the work that has been done for decades, centuries really, by nurses, but now really leverage it, because that'll allow nurses to take a much more significant role in the healthcare system, I think, and only to the betterment of our patients, really.
So what do you think Bloomberg Nursing's role is in bringing this awareness? What can we do as either faculty, as researchers, as students, as alumni? What can we do to increase this awareness of the importance of public health and community nursing?
I think I'll start. I think so part of my role is being in practice in community, but another part of my role is being an educator. And I think, one of the things that has happened in the media has been, and I don't want to amplify the tensions that happen between acute care, primary care, community care, public health, but I do think where we sit and where we work in the community in other sectors has kind of been missed in some of what's happening. A lot of the focus has been on acute care. And so that, all of this work that we are doing and that we are doing to support acute care is not being shown as much in the media. And the other thing I think as an educator is really around making sure that our undergraduate and graduate students get to see these roles, get to see people in practice, get to have clinical placements in these settings. You know, I'm so afraid that things are going to get tighter in terms of getting placements, getting opportunities to give our students the opportunity to see nurses doing this work in practice, not just at this wonderful event, but being able to come into practice and see all of us doing this work with our communities.
Yeah, I would agree. And I think a very interesting piece around nursing is looking at the organizational and systems piece and how we actually fit into that. Looking at community health centers, looking at family health teams, looking at Ontario Health, looking at Ontario Health teams. These are all really interesting things that nurses are a part of each of them. And I believe that looking at the overall umbrella of that and how nurses can fit in, because you'll see a thread, you'll see like a puzzle through all of it. And that's integral, I think, to this work. And it's fascinating and it's really interesting and how it actually can leverage and further allow us to look at that integrated fabric that we make of the system. The principles that we work from in community care or in nursing are equity, diversity, teamwork, collaboration, education, knowledge translation. But these are all of which nurses have and embody. And I believe that we can leverage that and look at that and where nurses are situating themselves within these systemic or the systems of healthcare and leverage that and raise that to the public view. I think that would be really impactful.
Thanks, Vanessa. Jean, did you have anything further to add?
Yeah, so I'll just add from an academic perspective, and you know, just I think that we do have a really important role to play as instructors. You know, the three of us have worked in teaching and developing the global health course for nurse practitioners, and just really talking about all of these issues, whether it's communicable disease, chronic disease on a global level, whether it's, you know, environmental health and how that shifts communicable disease from one place to another. We've all tried to incorporate that so that our students come out with an understanding of a very broad view, as well as how, as Vanessa said before, it lands in your own backyard. Global health is local health, and how it all really integrates, and just the challenges of that. And I think elevating, you know, community health, you know, oftentimes it's not one of those areas of nursing that's considered sort of I don't know, really pivotal, when in actual fact, my experience in whether it's primary health care and you know the gamut of the lifespan, to public health where you are working in epidemiology and you are managing and dealing with outbreaks and all of that, is probably one of the most exciting areas in nursing. And I think this is an opportunity to really excite our students about community health nursing and what it can be for them as a really exciting part of a career. And I'm excited to do that when I'm educating and trying to incorporate that into curriculum.
Thank you, Jean. And I can completely agree about the global health. I mean, it's never been more evident as it is right now, the impact of health around the globe and what that means to us locally. So thank you for sharing some of your thoughts. I think it's been really thought-provoking, and I'm sure there are many participants who would like to ask questions as well or raise some issues that are important to them. So I'm going to open it up now to audience questions. So you can either enter your question in the chat box, or you can raise your hand and ask your question as well to our panelists, or questions, comments. We're more than happy to have a discussion. So if you'd like to go ahead and open it up to enter either chat, or you can put your hand up and we can ask those questions. Okay, so we have one, and this is a really nice question, I think. What is your most rewarding nursing experience? It's probably hard to narrow it down, as Marcia has said, but is it now during this pandemic, or do you need time to reflect on this later when you're out of this crisis? Can you tell us a little bit about your most rewarding nursing experience? Jean, do you want to start?
Sure. Yeah, so there's, I think the grateful thing for me is that when you asked that question, I had a flood of memories that came forward for me, which just reinforces to me that I'm in the right profession, because it's been rewarding for 30 years. And so, I think of, I think of different scenarios, but the interesting thing is the common thread is the patients. It's the people. Whether it's working in the Indigenous communities where I just, the people were just the most phenomenal, wonderful, gracious population to work with and to work for. It was humbling, just how amazing it was, or whether it was seeing how the Canadian Forces troops work on the ground in Bosnia, protecting us in a way that, I think as a general Canadian citizen, I really didn't even comprehend. And it floods my heart at the thought of those people in their protective roles. So, and then the work that I could do with them and to further sort of protect them and work with them around the things that they need too. So I would say that that's the most rewarding is the people that I work with.
Thank you for sharing that, Jean. Vanessa, can you share with us?
Yeah, well, there's two. So I feel so fortunate to do the work that I do. I work in a refugee clinic, and I work with newcomers, and it's nursing that allows me to feel so fortunate, and the open and honest conversations I can have with some patients. And one woman I had connected with more recently over several years, and then she said something to me around all these moments remind me of myself in a way. She showed me, she's away from her family. She showed me a picture of her son going to school, to kindergarten on the first day. She showed me his report card, and different patients, they have different experiences about their families, right? And their parents passing away or different things. And so these are all such deep moments that I feel so grateful to have. And one patient recently said, I just want to give something back. And I said, you are, every single day you are. And just the idea of her wanting to volunteer or do something else to give back to Toronto or Canada. And I said, you already are, right? So I think the idea of having connections with an organization with COVID, I work in a couple refugee shelters and other shelters in Toronto, or congregate living sites, and having some relationships with them and having the trust to be able to go in and do some COVID testing and then offer that into vaccinating is really, really cool. Having that opportunity to say like, what works for you? And like, I'm a guest, like I'm invited into their home time and time again. And I think it speaks to what Jean was saying. It's the most special experience to be invited into someone's home week after week to do this. And so that makes it 100% worthwhile.
Thanks, Vanessa. Joanne?
Yeah, I think about, there's so many things. I think about my deep unending gratitude to all of the populations that I serve. When I think about people who are medically uninsured, they have made such a brave choice to stay and to live and to survive and to do something different for their families and for themselves. I'm just honored to work with them and to hear their stories. I'm honored to hear the stories of my clients who are using substances and are trying to live. And being able to help them do that. And I'm honored to be a nurse, quite frankly. I still don't know how I ended up here, but I'm honored to be part of this profession, and I'm honored to be in the position I am, teaching students from my own positionality and being a face for students, and having wonderful colleagues and advocates and researchers and educators to work alongside. So yeah, it's all very rewarding.
Well, listening to all three of you, I think probably all of the people that you work with, whether it be patients or students or colleagues, are all very fortunate to be able to work alongside such amazing nurses. So I'm going to go to Kelsey's question about your incredible careers that you've shared with us and how you've been able to advocate for your respective communities. So can you give us and Kelsey some advice for a new grad NP looking to have a similarly impactful career? Because really all three of you have had significant impacts. What would be your advice?
Hey, Kelsey. Hi. Yeah, Kelsey's a friend and a colleague and a student of mine before. So thanks. Sorry, I don't mean to put you on the spot. Just want to make sure I could say hi. I would say hold true to your principles, and whatever in terms of I think a lot of what we've talked about today has been common themes that we found through our careers, and we've taken different paths and different trajectories to get there. But I think a lot of us have different a thread that has been similar within a lot of our different paths that we've taken. And I think it would be to hone in on what that is, what is that thread, and keep working towards it. Those principles. It's not so much, when you look at it, it's not us as people, it's more the principles that we're working toward. And so the advocacy that nurses do, I think we have to feel very confident about that, because we're raising nurses' voices, but we're raising them to voices regarding the principles that we hold so true and so dear that are definitely need to be advocated for and raised. And I would say finding mentors is great, talking to people who you can connect to and find similar interests and avenues of work, asking questions, always being curious and asking lots and lots and lots of questions.
Good advice. Joanne, do you want to add to that?
Yeah, I think being willing to try. I think there is a lot of nursing is a well-respected profession. It's a secure profession, but being willing to try to step outside your box, to step outside your comfort, but also not just to focus on the individual patient care, but think about the bigger movements that are happening, right? We're celebrating Nursing Week, and there's lots of reasons to celebrate, but there's also lots of reasons to be angry and hurt this week, right? Like nurses have been working really hard. We're working for a government that doesn't necessarily respect us. And so being part of the bigger advocacy movements that are going to make change around some of what's happening to nursing and to nursing profession, I think also is part of the work that we need to do. But go for it, because it's great work.
Thanks, Joanne. Jean?
Yeah, and just I think I'm building on Joanne. So Joanne really said what I was thinking from an advocacy perspective, and Vanessa talked about being at the table. And I think nursing needs to be at the table more. I think that I like the saying from Brene Brown that says, have a strong back, a soft front, and a wild heart. And I think nursing, I think with humility, but with strength, we need to be sitting at those tables, insisting on being part of the discussion and the decision making. Whether it's whatever level, I think that is continuing to be something that we need to really push for at the healthcare discussion tables. And whether it's whatever change you're trying to make as a nurse in your career or moving forward, I think you know, be as wild and push the boundaries in whatever ways that you want to, and learn the art of influencing in having, you know, that strong conviction with a soft presentation that's not going to let go. So, yeah.
Thank you, Jean. And I think that that's a great message to end on. So I want to thank you all for your insight and your honesty as we've had this personal discussion about the importance of public health, community public health nursing. So I'm going to turn it back over to Dean Johnston to end our conversation this evening.
Thank you very much, Kelly. And thank you, Joanne, Jean and Vanessa for that thought-provoking discussion. I mean, the irony is not lost on me that this faculty was founded over 100 years ago on the premise of public health nursing under Kathleen Russell. And yet here we are talking about it again and its value to the communities we serve. The words that I heard were partnership, advocacy, the role of nurses ensuring the voiceless are heard. And in thinking about the pandemic, for me, if I have to search for a positive, it's that there is a heightened awareness of the role of nurses in public health and primary care. Nursing Week is an opportunity to inspire others about the profession also. And I know we have many students in the audience, and I'm certain our panelists have met the brief to inspire them to consider careers in public health and serving the communities that are in need. We still have one Nursing Week event left this week, which is a compassion fatigue workshop with Randy May, Stanford-Leibold, and we'll include the link to the event in this email that we send after this event tonight. And I'll also invite you to visit our website for further details and to check our social media channels. Thank you again for attending our feature event for Nursing Week. And I'll leave you with a quote from arguably one of the best known public health nurses, Nightingale, of course, whose birthday is tomorrow, May 12. Rather 10 times die in the surf, heralding the way to a new world, than stand idly on the shore. Thank you very much, everybody. Stay safe and stay well, and hope we see each other again in person soon.